Juha from Superhero Capital. We're VC based here in Helsinki. We do up to 500,000 tickets, mostly with the B2B angle.
Very good. Juho.
Hello, my name is Juho. I'm a business-minded medical doctor. I still practice part-time, but I mainly work as a management consultant focused on healthcare sector.
Very good. Thank you.
Hello, everybody. My name is Antti Kangas. I'm from Nightingale Health, which was formerly known as BrainShake, and we're a blood testing company with a strong scientific background, and our goal is to enable people to forecast their health in order to prevent chronic diseases.
Very good. Minna.
Hello, I'm Minna, Tanskanen, Chief Wellbeing Officer at Digiterveys, and we are offering a holistic approach of wellbeing coaching.
Very good. So a good panel, and now we're going to crunch and study the element of big data. So as the panels and keynotes have been discussing the elements of big data, that's going to be massive, it's going to be more open, the 30-year perspective that it's all going to be open. Was it Phillips who gave this point of view? So Juha, how would you see it? So open up, what is health, big data, and use on that? Just give us a big picture.
Oh, that was an easy one. I would rather turn this into the problem that you're solving. What I see many times is startups are too focused on the market and the market size and things like that, whereas you should be more focused on the size of the problem. So unless you're really solving a relevant problem, you won't have a business. I mean, that's how it is. And let's face it, world really doesn't need another sensor that will measure whether your ass will vibrate at the same frequency as your heart is beating. We already have enough of that stuff. What you really need to do is crack the challenge on what does it mean, so what? That's the real question you should be asking yourself every single day. So if we do this, so what? What does it mean for consumers? What does it mean for healthcare professionals? Why are we actually trying to solve this specific problem? And is it big enough? Is it a problem that someone is really willing to pay for it? Now, of course, the big data, however you define it, is going to change that. But ultimately, I think that the problem is the one that really prevails. And you need to be able to solve real problems. Life is too short to do stupid things, so solve the real problems. The world has enough real problems, right? And we need to solve them.
Very good.
Okay.
Good opener, thank you. Antti, if you want to comment on that.
Yeah, thanks for this opening. I see that, of course, at the end we want to stay healthy, and now we have kind of a lot of data about health and sickness. But I would like to kind of do an inventory about what kind of data we really have. So from the healthy people, we have all these, as you mentioned, data from all of these devices and kind of measuring what we do. And then we have a lot of hospital data and electronic records from patient care where the people are actually already sick. And there we have the deep data, and there we have some molecular data and imaging, and kind of the sicker you get, the more data you will produce for kind of our use. But in order to learn from health, in order to keep people healthy, we need more detailed data on health itself. Kind of what are the processes that start slowly to kind of put you to imbalance of kind of falling into state of disease. There are a million ways to be healthy until you collapse into a very confined state of being sick, or even more confined state of being dead.
So as a comment, do you say that as you open up with the big data and you should, what is the problem you're solving? You see it's a challenge that we're collecting this massive amount of data, but it's not right kind of, or as you would like to see more data collected?
What I would like to say is that in the domain of health, we have data about what people do. They exercise and they sleep well, or they sleep badly, but we don't have kind of a measure. We don't measure what's happening inside the people. We don't know much about the actual state they're in when they're doing these things. So I think that kind of data would be the key. We should be more interested in healthcare in general. We should learn more about kind of health, because that's the gold standard of medicine.
Minna, if you would like to comment on that, as you see a lot of...
Yes, about data, we certainly have it from everywhere. And my point of view is that it's quite a spread over. And it should be collected the same place and compare and combine. And on that way, we should we could have a personalized, motivated information for you, what you should be doing and what is best for you. At the moment, you have to have be a physiology or that kind of thing that you can somehow analyze the data and try to find those things what are important just for you. It's really complicated. About that data, we researchers are really interested of that. That we live for that. But is it important for a single person who is just trying to struggle his or her personal life? And in the first place, we should ask, what is your goal? And how we get motivated people to achieve their goals. And somehow those big data can help on that.
Maybe I'll take a quick reply and then Juha. If you want to reply on that, or?
Well, I think I'll have a chance.
Very good, you have a chance. So Juha.
Okay, yeah, well, think about big data and health. We usually remember wearables, for example, but we quite often forget that a lot of, or actually the majority of the data is unstructured, which is quite emphasized yesterday in watching presentations by IBM. And for example, take electronic medical records. There are a lot of information concerning the patient's disease and health status. And we are not taking advantage of it because we can't follow it very well, because it's somewhere embedded in the text as a free string or text form, and it's hard to take grip of it.
Well, would you like a concrete example as Mehiläinen? So you have that information of your own customers and compare that to the big data of public sector, for example. So do you have a strategy which covers the term big data somehow?
Well, I think there's not that big difference between private and the public sectors. There might be company-specific initiatives. I know that Terveystalo has offered their own service for tracking personal basic diseases. It's called Etudy. It's a good program probably, but it's just a start. But
so you still feel the players of the field are in their early days and could we say not that good yet?
I think so. But on the other hand, there are some quality registries coming up, and there's a quite big discussion about them, and they're coming.
Very good. Okay. Did you have a comment on that, or we'll continue? Okay. Well. So we have a little bit about how the players of the ecosystem, what big data is, and of course that's a big term and a lot of point of view. So let's go to the challenges as we have a lot of information and Mehiläinen one as an example. So would you like to concrete examples of what are the challenges you're facing?
Okay. Of course, I look at the things from the clinician side, and the healthcare services sector. It's quite conservative. Doctors and nurses are educated to follow evidence-based guidelines, and if your wearable is not embedded in the guidelines, you probably don't care about it. I guess it's a challenge of massive amount of information surrounding you. That's basically the first thing, I guess.
Yeah.
And another thing is that at least in Finland, the electronic medical records, integration to them has been quite difficult, at least so far, for the third-party providers.
Very good. So what would you say the challenge? Okay, the conservative ecosystem, but the solutions yet available. So you are, for example, you from Mehiläinen, you're actively scouting, but you don't have good solutions to fit your problems currently, or you just don't know what the problems or possibilities even are.
I'm probably not the best person to comment Mehiläinen's decisions because I only practice there. But
okay.
Yeah.
Okay, very good. Let's leave it there. Okay, Antti, had a comment on that?
Yeah, of course. Healthcare is a conservative field, as you said, and kind of the data is here and there and siloed and in a difficult format. But if we kind of look other examples of successful usage of big data, we of course think about these big internet giants such as Google and Facebook and Amazon. And what we can learn about them, one thing common about them is that they own the means of generating the data. So they have all the tools. They give the tools to people, and people make the data, and they can decide in what format they will collect it, and they can kind of keep that going. So that's what's lacking in healthcare, and I think that's a good thing because we wouldn't want kind of one big company to own every hospital and every wearable and every kind of, if you know what I mean. And kind of to overcome that obstacle, because of course if there would be one big actor in the field, then kind of all the possibilities of this big data would be exploited and kind of everything would happen. Now there are so many actors that it doesn't happen, but one way to kind of overcome this problem is to actively start to making data open, as we've heard kind of from other talks here. In that way, there would be big companies taking all of that and building their products on that, but there would also be smaller companies, and it would kind of be the benefit of all to just kind of give it everything to the public.
Sounds like a Linux world. Very good. Thank you. Yeah. You had a comment on that.
So I think you're absolutely right, and I think one of the questions we should all be asking ourselves is who actually owns the data? For example, if you push your health data or patient data, whatever it is, into a cloud service like, let's say, IBM Watson, which you just mentioned, no offense, you will never ever get it back. Believe me, that's gone. Even if you want it back, you will not get it. You can never be sure where the data will ultimately be. For example, what happened in Iceland, they broke down genome of 180,000 people in Iceland. There's only 310 people in total, so half of the population. And the data was actually owned by a private company who went bust, belly up, bankruptcy. And now that data is owned by the Chinese. They bought the data from that company. Now, if I would be an Icelandic person, I would be quite concerned, what are the Chinese going to do with my genome data? And these are just examples that you really have to think when you're considering the big data. What will actually happen if I run that data in the cloud, and who will ultimately own that data and the results of whatever happens to it?
Very good. Juha, then Minna.
Yeah. Just quickly returning your questions, what are the challenges? I guess it's the massive amount of information available, but I'm quite sure that big part of it's more just nice to know instead of it having clinical implications, for example.
Very good. Okay. Minna, you had a comment as well.
Yeah, about big data and my data. So who cares? So what is so difficult, or what is the strange thing of if my data is spreading somewhere, if somebody somehow gets information of that? But the point is...
A lot of people care.
Yeah, some people care.
A lot of people care.
Yeah, and a lot of people, okay. But point is, for what we are using that data, as was the question for today. So if we have the big data there, and how we can solve it in that way that one person will get those information, what is relevant for him or her, and on that way have a motivation to improve their well-being. I mean, that's the goal. And what is the goal of having that data there?
I think what you said in the beginning is interesting. This division between the sort of health data for healthy people and then the data coming out of sick people. And I think that's really is the thing. The challenge there obviously is that systems like we have here in the Nordics, the money is roughly divided, like 95% is the sick care and 5% of the money available is on the preventive side. And yet we have a lot of data from the health people, which is really not used to prevent them from becoming sick, like you said. And this is the challenge on how we can balance between these two and actually combine the data and figure out that, okay, well, if you have these kind of results from whatever, let's say, wearable, for example, you use, what are the odds of you getting sick on something? Combine that with gene data, genome data, et cetera, et cetera. This is really the interesting part, and this is something that should be solved, I think.
But do I care if I get sick? Even I get that data, what the hell? Do I have a motivation to do something that I don't get sick? That's the point.
Yeah, I see your point and yours too. And I think, of course, what the big data would allow us to do is to start learning from the data kind of in continuous way in healthcare. So we would also we should globally be able to see what kind of treatments will result in better health and which will not, and what kind of lifestyle interventions, if I go jogging, will it improve my health. But that requires this one kind of magical thing that there isn't yet available, is a measure of health. So that might sound like a video game thing, so my health is like 52 and your health is 48. But they're kind of, if you think about what is health, it's not being sick. So basically we could measure health by a figure which would tell you the risk of getting a certain disease, say, within 10 years. So, of course, if you're healthy and 25, you don't have to worry about being kind of having a heart attack. But still, you might have a small risk number which you can then contrast against kind of your peers. And in that way, you could measure your health. And by following that, kind of constantly assessing your risk of getting sick, you could then kind of learn from the choices you make. And there you have these wearables. And kind of you can say that, okay, my sleep activity or physical activity has been this, and it improved my health. Now this works. And this information should be taken advantage of globally. And that kind of, I think the key is a good measure of health that we're lacking.
Very good. Okay, Juha.
So I think being healthy is subjective. So let me ask the audience, who's healthy? Hands up. Who's sick? Hands up. 1, 2, 3. Not many. Very healthy bunch. But it's subjective. There isn't any. I don't think it's 0 or 1 or black and white. It can be kind of in between, if you understand what I mean. So it's a subjective.
Yeah, and I think we don't disagree here. I think we just we can with this kind of measure for health. We just have to build kind of some kind of metric to that in order to kind of being able to use these other devices that collect information about your choices. But of course we know that there's a pathway from being health to being diagnosed, and because diagnosis is a 1 and 0 thing, and we can calculate a risk to be diagnosed in the next 10 years, and that could show you kind of well in advance if you think that you're healthy, you can still learn that your risk of developing certain disease, if you don't do anything, will be this, and it will be higher if you don't do something else.
Very good comments. I have to step in here as well, as we're on a very high level of handling that big data, healthy, not. Let's take a little bit more concrete for us everyday users, being an amateur, not related to health in that sense. So for me, the closest, let's say, the iPhone offers the health app. But it's quite crappy because the only thing it measures is how much I walk. I would love to use it. I would love to have more push. I would be interested in getting more information. And I trust the big brother Apple that they will handle it at some level confidentially. Will there be Apple Hospital? We don't know. But somehow it still doesn't work. There are not devices. It doesn't know how to. It doesn't say hello and how are you doing. Every morning I wake up. So the more problem is handling that big data on the micro level and then taking it big. So it seems like, how do you see the future going on that path? Minna?
Yeah, where you are interested of that more data and so on. Well, Watson can somehow calculate your risk for something, and on that way give some descriptions what to do. And the point is, after that, do you want to do it, and do you have a motivation to do that? Now I lost my thoughts. Let's have a...
Well, you can give a comment there, and I'm sure you're going to get that back.
I can back you up. Yeah. So I think you touched the real point here. The data must be meaningful. That's what matters. So, for example, I've tried at least 15 of these sleep trackers, and they always tell me that I've slept 7 hours and 10 minutes. So what? I know that even without the tracker. And then the question is, then what? How do I sleep? If I didn't sleep well, it will never tell me what to do differently. So it's a point solution. The information is mostly useless, and I would like to have it combined, maybe not the big brother you love so much, Apple, but someone should do it. I'm an Apple guy as well, so maybe it's... someone should do it to combine that with the nutritional data, sleep data, maybe if I exercise, whatever other data there is available, and tell me something that is useful in an easy manner, so that I can have a look and I know what to do next.
You read my thoughts. And Watson can maybe somehow combine those and give you some descriptions, but then comes a coach will give you those tips. Because if I ask from you what other you have in your life which has caused that you have slept well, Watson doesn't know that and can't combine that information, those tips what you should do. So combining individual personalized meetings with those data, that's
very good.
and that way we should go.
Because this is important, before we go, I would like to hear some concrete, as we're combining the big data and handling that information. So would you like to share some of the good examples? If we're still not in the edge of good solutions and good discussion with the digital and personal. So any good examples where it's already working? What gets you excited when it comes to big data? Anybody would like to open on that part? Antti.
Well, I don't think if it's really, well, it's can be considered big data or kind of at least a crowdsourced solution. But for instance, I guess you all know this Patients Like Me service, which is
Patients Like Me.
Patients Like Me.
Patient Like Me, yeah.
Yeah, so that's kind of just people listing their symptoms, telling about their kind of path of getting sick, and finding peers and kind of discussing about what worked for you and what worked for me. So kind of you can find peers, and that's a very very analog and basic example of what this could be. Kind of if we had these systems that would do this automatically, so the healthcare would continuously learn of the results, then we wouldn't have to have these kind of platforms where people talk to each other and spread kind of information in an analog way. We could boost it up with data, but I think that's a good kind of, that's something that could be.
Very good. So crowdsourcing. Okay, Juho.
Yeah, there are a couple of quite well-working ECG devices, electrocardiogram, heart film.
ECG.
Yeah, ECG.
Like
Like you can measure your heart impulses. Of course, it's not that accurate as in hospital. It's not 12 leads. It's just one. But for a specific audience, it could be quite well working to, for example, to show if you have atrial fibrillation, which is the most common arrhythmia for heart, and that could assist you with preventing the stroke, for example. And there are a couple of devices on the market, and I think they are quite good.
Very good. So single. It's just like for an amateur like myself, not in the sector. It's just like reading. Was it Helsingin Sanomat a few days ago that this some thesis was made about calculating what is ohitusleikkaus. Bypass, exactly. And just the individual person calculating that element, building a calculating model for that instead of having the experts analyzing when should it be done, a bypass or not. So it seems like we're really on the edge of, we're not at all on the big data level. So crowdfunding, just gathering information is just an eye-opening. And then getting the IE or anything, the computer elements to discussion that. So I think it seems like we're very on the beginning, very amateur in one sense. Or are we? Any comments?
Yeah, I think so, but I guess our time horizon is quite short. I mean, a lot of things will probably happen in the next few years, so you probably don't have to wait for too long.
Yeah, so it seems like this is like the Wild West somehow from an outsider perspective, that there's a lot of land to be conquered and somebody contains good stuff and not, and it's just to be really active and dynamic. It seems like. So what element of the big data, it's really, just to go and try. Minna?
Well, okay, you had get information that you might have a risk for a heart attack, and you are not taking your physical activity pill every day, and you are still smoking. Okay, you get a heart attack and have a bypass, and after that, you still continue smoking and don't get your daily pill of physical activity. So what to do with that data at the first place at all, if there is no motivation to change your behavior?
Very good. Okay, Juha.
Well, yeah, I fully understand that what you're saying. I mean, that's how people usually are, and that's a challenge for startups because a lot of you think that you can actually change human behavior. Well, I have doubts on that. It's just like you said. But the other thing is related to big data, that AI will change a lot. I mean, AI will ultimately change all industries, every single one, including, for example, us as investors. It will change. It will change all of yours. The question is when and how. So make no mistake, it will change. And it will especially change health and wellness industry, because it can do a lot of analyses that are currently either way too expensive, way too hard, or there's a other reason why they cannot be done. But in the future, they will be done. So that's something that you all need to consider. How will you utilize AI? But remember, the question is also who then owns the data if you use a third-party service.
Very good. Let's say we're finalizing this panel, but what do you think? What's your prognosis for timeline? When do we have when does my heart health app actually communicate with me? You want to throw out a number, or just how far away are we?
Very hard to say. Better to say nothing. So
very good. Okay, good. Fun.
I'd be optimistic and go for 5 years. It will do something else.
5
Give you
years
recommendations as well, and
okay.
Elaborate recommendations and arguments backed up.
Excellent. Okay.
I think if we open up the data and we will have a repository of global data, and we will also have this kind of measurement for health against which we could improve our medicine. There's kind of it's not going to be many years when some AI will just get, even if it would be unstructured data, it would be no problem.
Very good.
We would have these automatic solutions.
Good. I mean, you can say the final right answer. No pressure there.
What in the future? IoT, I think, is the answer.
Okay.
So
very
combining
good.
things and collecting data at the same place and compare and have a good motivated tips for individual persons based on that.
Good. I think we're going to have this theme on quite many of the future events in the future. So let's give a big applause. Thank you very much for joining the panel.